Hi guys, welcome to this talk on spinal pain relating to disc injuries. So I just want to get started with just a little bit of basic anatomy just to kind of help you understand a bit better about what's actually going on when we have a disc injury and what the discs are made up of, okay? So in your spine, between the vertebrae, which are the individual bones, you've got discs, okay? To it, okay? So you've got a middle bit, which is called the nucleus pulposus. This is sort of like it's almost like a gel. So it's a gelatinous kind of core, which contains collagen and elastin fibers, and also a hydrating gel. So that's what keeps the disc sort of nice and lubricated and hydrated. And then outside of that, you've got what's called the annulus fibrosus, and this is just a really complex series of like fibrous rings that just go around the nucleus pulposus just to help kind of keep it stable, okay? And these discs, they sit in between the vertebral bodies. So your vertebrae, you've got a vertebral body, and then you've got two bits coming out of the side. So this is the front of your disc, you've then got two sides coming out the back, and that's where your attachment is. So basically these discs, they help to absorb and sort of dissipate force. So when you think about it, when you're running, if you've got a lot of force going through your back and kind of coming back up through the floor, you've got these discs to sort of help to prevent these bones from knocking into each other, okay? And so that's sort of a little bit about discs and how sort of what they are, what their purpose is, and unfortunately these discs, they can herniate. So this is the main topic of today's discussion, and it's basically talking about when a disc herniates, what happens. So some of you might know it as a slip disc. We don't like to use the term slip disc because it gives across sort of like a wrong message. So the disc doesn't actually slip. So what happens is when you've got a disc injury, the nucleus pulposus, so the bit in the middle, some of it or all of it can protrude through to the annulus fibrosus, and then what happens there is then the disc can impact on the nerve roots that come out of your spine, and that's where your pain comes from, okay? So the disc doesn't actually slip, it's sort of like it protrudes out. And this can happen in three different directions. So one of the directions is posterior-laterally, so basically where it goes kind of diagonally out, so out of the back corners. Also, it can happen posteriorly, so that's just straight backwards, and it can also happen laterally, so out to each side, okay? If you have a posterolateral herniation, then that can affect the nerve root below. So say in your L5 vertebra, say that disc slipped, herniated, then you will find issues in the S1 nerve root, and basically that's all the nerves that supply like your buttocks, your hamstrings, the back of your leg, and also your back. There are a few different stages that herniations can happen, so it's not just one thing that happens, so it kind of is in like a progressive stages. So you have so they include like bulging, which is sort of like the initial stage, and then it also goes into protrusion, which is just basically relating to how much of that nucleus pulposus has protruded into the annulus fibrosus. So there's a lot of terms going on here. So just a bit of background around how often these injuries happen. So there are reported 5 to 20 cases per 1,000 people. So it's quite a relatively small number of people that are affected from disc herniations. And they tend to happen between the ages of 30 and 50. That tends to be where you see a lot of them, because the main cause of disc herniations is just sort of like the natural degenerative process of the human body, basically, with age. So unfortunately your discs will naturally degenerate, and it's just where the nucleus pulposus just starts drying out, and that can then lead to it protruding through. So in 95% of lower back disc injuries, it tends to be either the disc that sits between L4 and L5, or the disc that sits between L5 and S1. And again, these are the nerve root, and they'll affect the nerve roots that supply the lower leg, and sort of like the back of your lower leg, so your buttocks, your hamstrings, those sort of areas. But symptomatic disc herniations, so where the herniation is causing you pain, will affect only about 1 to 3% of back pain cases, and so you can get asymptomatic disc herniations, which is basically where you have a disc herniation but it's not causing you any issues, and these are things that can just be picked up when investigating something else, and it's not something that is, if it's not causing you pain, disc herniations, they tend to heal within a couple of weeks. So if it's not causing you any issues, then it's not, then you might not even know that you have it, basically. But on that topic, so symptoms, they can vary depending on the position and of the disc and the size of the herniation. So depending on which direction it's herniated or is protruding, and the size of the herniation. So again, remember we talked about those 4 different stages, so however far you are along those stages can affect the symptoms that you can get, but they can include quite severe back pain, and this can radiate into the lower limb if you've got a lumbar disc herniation, or also into the upper limb, so into your shoulder, elbow, hand, if you've got a disc herniation in the neck. They're a lot more common in the lower back, but they can happen anywhere throughout the body. But it tends to be, the lower back is most common, and then you can get it in the neck, and then it's very rare that you'll get it in the mid-back. The pain can radiate down into a shoulder, into your leg. Again, with lower back, they can affect your ability to walk. So you can find sort of issues with walking, so whether that's you walk with a slight limp, whatever it might be. Muscles can also spasm, and you might feel a tingling sensation, something like pins and needles, or even some numbness in the peripheral in your limbs, and again, this may be an indicator that you have a herniated disc, and you can also feel some weakness in the area, so you might not, so that's how it can affect your gait. You might not be able to walk as comfortably and as freely if you've got a herniation of that lower back. So it tends to be if you were to come into clinic and you have some of these symptoms, the way that we would be able to diagnose it and test it is there are some tests that we can do that will assess the integrity of the nerve. So, say you were getting pain like down the back of your leg, we can test the integrity of the nerve and compare it to the other side, and that can be a really good indication of whether you have a herniated disc or not. So now on to some positive things. How can we help? So the big thing around these disc injuries, like I said, is that they tend to heal within a couple weeks, but that doesn't mean that obviously your pain will go. So what we will do if you were to come into clinic is we would look first at sort of pain and symptom management. So, you know, there's various ways that we can do that. And then we would, once we've got your pain like significantly down and we're managing your symptoms, then we would look at trying to train your core. And so especially if it's the lower back where the issue is, we look at really trying to train your core and really trying to build up the stability around the area, as this can really help, you know, with your pain and also with your ability to tolerate high forces. Okay. And another thing is another kind of cause that can lead to disc herniations is living quite a sedentary life, or having poor health habits as well. So whether it's not eating the right things or smoking can also affect it. So looking to try and get an individual active again, progressively sort of getting them back into physical activity, can really help with not only symptoms but also with reducing the risk of this happening again. And again, another cause that can be, you know, related with a disc injury is repetitive like twisting or bending, and so again, strengthening the core and the muscles around the area is a really good way of making sure that you're able to tolerate that bending, that twisting, and keep everything nice and strong and stable and get good foundations in for further movement. So I hope you've enjoyed this talk. If you relate to anything that I've said in this video, feel free to give us a call or drop us an email, and we can get you assessed and we'll have a look at trying to get you better. Thank you very much. Any questions, leave them in the comments.